should you wear a bra in labor, or should you even bring a bra with you? Today, we're going to answer this question. And it is something that I saw during my 20 years in labor and delivery. I saw patients who labored with a bra on and some of the benefits of that, and some patients who labored without a bra and some of the benefits of that. So today, I'm going to tell you the pluses and minuses of wearing a bra during labor. Plus, I'm going to talk to you about some different things to consider about the bra that you're wearing or the top that you're wearing. So stay tuned for what to wear during labor. Questions like this are so common. I get it a lot on my pregnancy nurse page, and a lot of it just comes down to people want to know kind of what to expect during labor. And if you want to do that all in one place, I'm going to link the class that I recommend down below for you guys. But you shouldn't feel bad about having this question. I think it's totally normal, especially as our chests change during pregnancy. Ugh, it's a lot. So, should you wear a bra during labor? Now, across the board, my recommendation is to wear what you normally sleep in. Some of you are wearing a bra because your boobs have gotten heavy and very annoying during pregnancy, so wearing a bra as you sleep helps you feel a little bit more comfortable. Some of you are like, Hilary, I would absolutely never do that. I am in that camp, and I gotta say, in my last few weeks of pregnancy, I actually started wearing a bra because my bosoms were getting so big. So wear what you normally sleep in, or plan to wear what you normally sleep in. That being said, I actually think everyone should bring a bra because you may get into labor and find that you wish that you had one. Now, why would you want to wear a bra during labor? I know a lot of you are like, Hilary, why on earth would someone do that? The first one obviously is support. Your breasts may sag to a point that it feels really uncomfortable, or as they lay on your pregnant belly, that isn't a fun thing either. So a lot of people like to pull those breasts up and wear a bra. And the second reason is coverage. A lot of people don't want to have that labor and delivery gown on, which is completely fine with me, but they would like to be a little bit covered up top. And so coverage of the breasts area can be really nice in labor as well. And a lot of people end up wearing a bra because of that. Now, if you're just looking to do it for coverage, that's a very light, easy bra versus support. That's going to be a different kind of bra, right? So think about which camp you would be in. And as a note, if you're watching this when you're like 20 weeks pregnant, let me be the sayer that your breasts are going to change quite a lot during this pregnancy. And so, this really isn't a decision that you should make until you're well into your third trimester, 34, 35 weeks. And a lot of people decide which bra they're going to bring right as they're going out the door. I actually have a whole video on what to do right as you're heading to the hospital, right before you go into the hospital. And I'll link that one down below, because this is one of the things you might want to throw in your bag last minute as you decide where your breasts are at now. Hopefully they're on your body. Now, why wouldn't you want a bra on during labor? In general, it's just because of the heat and the constriction. People just don't want that when they're already uncomfortable from labor. That is what I have found. The other thing is it can be really annoying with the things that we have in the hospital. If you're wearing a bra that doesn't have detachable straps, getting it around the IV can be annoying. And that annoyance for some people are like, I don't even want to deal with that. I just want the bra off. And that's something that not a lot of people think about because they aren't used to the tube running up their arm. So that's kind of an insider tip. If you guys are interested in more tips, I actually have a whole insider tip series that's totally free. I'll link it down below for you. Now, what do providers want? I hear a lot of people go into labor and delivery and the nurse automatically says bra off. And honestly, I think that's what I did early in my career. But I usually just said panties off. And honestly, if you want to keep your panties on, that's completely fine for me. But usually we wanted them off for our initial examination. But there is a reason why providers do not love bras during labor. And the big one is metal. If you were to go into a C-section emergently and there was metal actually touching your skin, it can cause a burn because of that metal. So the first thing to consider is maybe pick a bra that doesn't have metal, or if it does have metal, it's encased. So if you have an underwire that is an actual wire, not just plastic, you'd want to make sure that it is encased within the bra. And if you have clasps that are metal, make sure that they are covered. I know a lot of the new bras are coming out where they have a covering that protects your skin from the metal, and those can be great as well. So if your provider is like, no, I need the bra, first, it's important to know that you get to make whatever choice you want during labor. I promise that the bra on or off is not really a huge deal. Just say, hey, I would rather keep my bra on. It doesn't have any metal in it. Do you want to take a peek at it? See if that allays any fears that they have. But most often, if you say, oh no, I want to keep my bra on, people are like, cool, that's fine. But again, if they push back, it's good to have some language that says, hey, it doesn't have any metal in it. I've thought through the things that are concerning you, things like that. The second thing to think about in a bra is do not wear one that you are absolutely in love with. Do not wear your favorite bra while you are in labor, because it could get very dirty and possibly it could get cut if things were really problematic. It is extremely rare, but I just don't wear the bra that you're the most favorite of when you're in labor. That's my best advice for you there. And one of my next tips is have removable straps. There's so many now that you can take the straps off. And if you have a bra like that, it makes going through the tubing so much easier, and you'll thank yourself for bringing that bra instead of a different one. This whole post is on my website, so I have links out to bras with these different kinds of things that you guys can check out. I'll link the post down below so you can check out the different brassieres that I recommend. I can't believe I'm a person who recommends brassieres. And let me remind you guys that it is so normal to have questions about what labor is going to be like. You're like, I don't want to wear a bra if I'm going to find out that absolutely everybody hates wearing the bra. And so I'm so glad that you guys are here to learn, what I've seen during all of my time in labor and delivery, and make good choices for yourself and realize that you can throw a bra in your bag either way. And if you want to get prepared with all of those tips, I'll put the link for that class down below. Now, the final thing to consider is that bras can be really annoying when you bring that sweet, sweet baby to your chest and you want to start to breastfeed. Now, it's super easy to just unclasp the bra, let baby have access to your nipples, or sometimes just to pull it out, especially if you have a super stretchy one. So that's something to consider as well. A lot of people love to wear a nursing bra during labor. That way they can just, if you haven't seen a nursing bra, maybe you haven't, they have little flaps that just come down that give you access to the nipple, and then you just pull the flap back up and re-clip it. Those can be really great to wear during labor as well. So as you consider what type of bra you're going to wear during pregnancy, think, is it one that I'm just going to want to wear for coverage? Is it one that I want to wear for support? One thing that I love that I saw a lot of moms use was just a tank top, a real loose tank top, obviously, or a maternity tank top that had a shelf bra. So that made them feel like they didn't even need to wear the hospital gown. They could just wear that and feel really comfortable that they were covered during labor. I saw a lot of moms really enjoy that, and I've seen those shelf bra tank tops out at lots of different stores. Again, I link to some in the post that this is on. I think that one can be a really good option for a lot of people. But is that going to be enough support for you? The other good thing about those is usually they're so stretchy, it's real easy to just pull it down and breastfeed. You don't have to worry so much about like a nursing bra or the nursing issue. And again, if you're watching this video early on, your breast may grow in size before you end up having your baby. So again, you're going to want to look for a bra that fits when you are in labor. So don't put that bra in too early, but it is a good thing to start thinking about in your mind about what you would like. And you might change your mind the later you get and the bigger your bosoms get. And side note, I have a whole video on breastfeeding your husband during pregnancy, because as the bosoms get bigger, it's a question people have. A lot of you are like, what? But whatever you are, I'm going to put that video down in the description. Now, wearing a bra is one of the choices that you might make at admission. Now, it is just one of the choices that you might make at admission. I actually have a whole video about the different choices that you'll make when you get to the hospital. I'm going to link it right here so that you can check it out. Thanks for joining us here at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.